If you have had a prior cesarean delivery, you may be wondering if you can have a vaginal birth for your next delivery. Many women are candidates for a trial of labor after cesarean, known as TOLAC, and at Northwell Health, we're here to help you explore your options safely.
What is trial of labor after cesarean, TOLAC, and who is a good candidate for it?
Women who have had a previous low transverse cesarean may attempt a trial of labor. The success rate of women who attempt a TOLAC is 60 to 80%. The success rate will depend on a variety of factors. For example, if you underwent cesarean delivery previously for failure to progress in labor, the cervix did not dilate, or the baby's head did not descend in the birth canal, your chances of having a vaginal delivery may be decreased. If you had a prior cesarean due to a malpresentation, breech, or transverse, your chance of having a vaginal delivery in the next pregnancy is increased. If you had a prior vaginal birth as well as a cesarean delivery, you are more likely to succeed than those who have not. Other factors that may decrease the success rate include advanced age of the mother, the body weight mass of the mother, a higher estimated fetal weight of the baby, and a gestational age greater than 40 weeks.
What are some contraindications to a trial of labor after cesarean delivery?
If you've had a previous classical or T-shaped incision or other transfundal uterine surgery, if you've had a prior uterine rupture, if you've had uterine surgery involving the myometrium, typically having fibroids removed, or if you have a medical or obstetric complication that precludes a vaginal delivery, for example, a placenta previa, which means a placenta which covers the cervix. Also, an inability to perform an emergency cesarean delivery because of unavailable surgeon, anesthesia, sufficient staff, or limitations of the facility.
What are the risks associated with TOLAC?
If a trial of labor is attempted, but a cesarean is needed during labor, there is a slightly increased risk of problems, such as infection of the uterus. The most serious complication of attempting a trial of labor is uterine rupture, which means a tear in the uterus. This can occur in less than 1% of cases. If the uterus does rupture, bleeding may occur and may require a blood transfusion and possibly bladder repair and/or hysterectomy, which means removal of the uterus. In rare cases, uterine rupture may result in fetal or maternal injury or death. If the healthcare provider agrees, patients with 2 prior cesarean deliveries may also attempt a trial of labor, but the risk of uterine rupture appears to be higher. Complications occur more frequently in women who attempt and fail a trial of labor.
What are the benefits of choosing a trial of labor and vaginal birth after cesarean, VBAC, over a repeat cesarean delivery?
A trial of labor after cesarean with successful vaginal birth after cesarean avoids major surgery and all the risks associated with surgery. The recovery time is shorter with vaginal birth than with cesarean delivery. A trial of labor with successful vaginal birth after cesarean may reduce the chances of future complications caused by multiple cesarean deliveries, bowel or bladder injury due to scar tissue, placental implantation issues that can lead to hysterectomy, removal of the uterus, and/or infection. This is important to consider when contemplating future pregnancies. Attempting a trial of labor after cesarean is a decision that should be made with the support of your healthcare team. If you're considering a trial of labor after cesarean, speak with your healthcare provider to understand your options and create a plan that works best for you and your baby.